Kia ora, nau mai, haere mai. We are the Gut Cancer Foundation, the voice of digestive cancers in Aotearoa, New Zealand. We provide information and resources to help you and your whānau navigate cancer. Did you know that your digestive system includes the esophagus, stomach, liver, gallbladder and bile ducts, pancreas, bowel, and anus? Each plays a vital role in digesting food and fluids, processing nutrients, absorbing energy, regulating blood sugar, and filtering waste. Cancer can occur in any of these organs when abnormal cells grow out of control. Let's take a closer look at the bowel. The bowel connects the stomach to the anus. It is part of the digestive system and is divided into two parts. The small bowel, also known as the small intestine, and the large bowel, also known as the large intestine. The small bowel is where most nutrients are absorbed. The large bowel is made up of the colon and the rectum. The colon finishes absorbing water and electrolytes, and the rectum stores the remaining contents until being passed out of the body. Bowel cancer occurs when abnormal cells in the bowel grow out of control. Bowel cancer, also called colorectal cancer, is the most common type of digestive cancer. Nearly all bowel cancers arise in the large bowel, but a small number arise in the small intestine or the anus. Most bowel cancers develop from small benign growths called polyps on the inside lining of the bowel. Not all polyps become cancerous, and the risk of developing cancer in a polyp depends on the type of polyp and its size. New Zealand has a national screening program for bowel cancer. If you are between 60 and 74 years old, you will be eligible. Screening is the best way to detect bowel cancer as early as possible. For more information on the national screening program, check out our website. Do not wait for screening if you have symptoms. The symptoms you should be looking out for are bleeding from the anus, rectal bleeding, without any obvious reason, straining, soreness, lumps, and itchiness around the anus, persistent change in bowel habit, for example going to the toilet more often or experiencing looser stools for several weeks, abdominal pain, especially if severe, any lumps in your tummy, weight loss, and tiredness. There are some other factors that may increase your risk of developing bowel cancer, which include some inflammatory conditions such as Crohn's disease and a family history of bowel cancer. There are some other factors such as your age, smoking, exposure to certain chemical fumes, obesity, poor diet, and high alcohol consumption over a long period of time that can increase your risk. If you have concerns about any of these symptoms, a GP will be happy to see you. If you're here because you or one of your whānau have received a diagnosis of bowel cancer, you can find heaps of information, including treatment options and access to support on our website. For more information, visit www.gutcancer.org.nz.